Welcome to the Caring for Newborn workshop, a collaboration with the Florida Department of Health Women's Health Initiative and Healthy Mothers, Healthy Babies of Palm Beach County. The objective of this presentation is to provide basic newborn care information and to reinforce skills needed during your newborn's first weeks at home. Whether you are first-time parents or preparing to become parents all over again, we hope to increase your confidence in caring for your new baby. Let's get started. Workshop objectives are participants will be able to effectively change their diaper and learn cord care. They will be able to effectively identify hunger cues and establish safe feeding environment. Participants will also be able to identify ways to soothe an infant, learn tips for getting baby ready for bedtime, how to safely put an infant to sleep, and the importance of a sleep routine. Your newborn is amazing. All 5 of their senses are functioning at birth. Sight. They're able to see approximately 8 inches away. Roughly the distance of when you're cradling your baby, when you're breastfeeding, bottle feeding, or just cuddling your baby and talking to them. Hearing. Your baby knows your voice. They recognize your voice. They've been hearing your voice for the last 9 months. Taste. They like the flavor of milk, but nothing that's too bitter or sour. Their ability to smell is functioning. They're able to turn their heads away from unpleasant odors, and they do recognize their mom's scent over anybody else's. Touch. A baby will calm to the warmth of your body and will turn towards when you stroke their cheek. Whether you decide to breastfeed or formula feed your baby should be fed whenever you see signs of hunger. Due to their small stomach size, this can be anywhere from 1 to 3 hours, or 8 or more times every 24 hours, including nighttime feedings. Breastfed babies should be offered each breast at each feeding. Formula-fed babies the bottle should be prepared ahead of time if possible, warming it slightly under running water or placing it in a pan of hot water for a few minutes. Never ever microwave your baby's bottle. Sometimes babies need to be burped. That can either be by placing them over your shoulder, sitting in them in your lap with support, or just laying them across your lap. This should be done every 10 minutes with breastfed babies or every 2 to 3 ounces with formula-fed babies. Sometimes babies burp, sometimes they don't, but it does not hurt to try. Feeding cues are ways that your newborn communicates that he or she is hungry. These signs range from early signs, which may include rooting or moving their head from side to side with an open mouth looking for a nipple, sticking their tongue out, and stirring. If not fed, an infant will become hungrier and more active as a result. Stretching and placing their hands in their mouth are mid-hunger signs. The final and less desirable cue is characterized by crying and agitated body movements. It is best to plan and prepare for your feedings ahead of time, as it is difficult to feed a crying baby. An important component of successful breastfeeding is an effective latch. The photo shows a newborn who is properly latched onto his mother's breast. Notice his mouth is wide open, the lips are flared outward, large amount of the breast is in the baby's mouth, and the baby's not just gnawing on the nipple, which will cause painful and cracked nipples. You see more of the areola above the baby's lip than below. The ear and the jaw will be moving. You also note active sucking and swallowing. You feel a tug that is not painful. Diapering your newborn is important in keeping your baby's skin dry and clean, and it helps prevent diaper rashes. You can expect to change your baby's diaper anywhere from 6 to 8 times on average, more if necessary. Preparation is key. You'll need to collect everything you need beforehand. For safety reasons, you cannot leave your baby unattended, not for 1 second. To avoid diaper rashes, change your baby's diaper when they're wet or soiled. You're going to gently clean with diaper wipes, taking extra care with the creases and folds, making certain with female babies, with the little girls, you're going to clean from front to back. Avoid using powders or special lotions unless recommended by the pediatrician. Consult your doctor if there's a rash that is not clearing up. Your baby's umbilical cord will usually drop off anywhere from 10 to 14 days. You're going to keep it clean and dry. When you're diapering, you're going to fold the diaper down to keep it open and get as much air as possible on it. Alcohol is no longer recommended. Until the baby's cord drops off, you're only going to do sponge baths. The purpose behind this is to keep the stump from getting wet. Never, ever, ever attempt to pull the stump off, even if it looks like it's just hanging off by a thread. Consult your healthcare provider if the skin around the baby's cord is red or irritated, if the baby cries when you touch the skin next to it, or if anything touches the cord, such as its clothing, or if the stump smells foul or gives off a yellowish discharge. Until your baby's cord falls off, a daily sponge bath is all that is needed. You'll place your baby on a flat surface and undress him or her. You're going to wrap him in a towel. Using a washcloth and plain water, you're going to gently wipe the eyes and wash the face. Using a soapy washcloth for the rest of the body, washing one area at a time, washing the diaper area last. Pat the baby dry, making certain that all the creases are nice and dry. Then you're going to dress your baby. Only after your newborn's cord has fallen off will you initiate a tub bath. You'll begin by making certain that all supplies are handy. Usually this involves a mild soap, a washcloth, and a towel. For safety reasons, you will never leave your newborn alone in a tub of water for any reason. If something comes up and you have to step away, you will wrap your baby in a towel and take your baby with you every single time. Before beginning, you'll fill a small tub with 2 to 3 inches of warm water, making certain that it's not too hot. You're going to support your baby's head with one hand and use the other hand to support the body, placing the baby in the tub feet first. You're going to use a washcloth using plain warm water and gently clean your baby's face. With the soapy washcloth for the rest of the body, cleaning one area at a time, saving the diaper area for last, making certain that you pat the babies dry, focusing on the creases. Because babies are not yet crawling, they do not need to have a bath every day. A few times a week is sufficient. Because babies can't communicate through verbal language, they communicate through crying. They are telling us how they feel or what they need. Babies cry when they need feeding, changing, soothing, or don't feel well. When your baby is communicating with you through crying, there's a couple things you need to check. See if they're hungry. See if their diapers needs to be changed. Maybe they need to be burped. Or maybe they don't feel well. Maybe they just want to be held. Try rocking them, walking with them, cuddling, singing, swaddle them, play soft music, offer them a pacifier, and see what happens. Your newborn's sleeping arrangement should be established prior to coming home from the hospital. Your baby needs their own bassinet, pack and play, or crib, preferably in the parent's room, at least up until the first year of life. Remember these ABCs of safe sleep. Alone. A baby should always sleep alone. Not with the parents, not with anyone. Sleep alone, placed on their back, face up to sleep. In a crib with a firm mattress, tight-fitting sheet, and nothing else in the crib. No toys, no bumpers, no blankets, no pads, nothing but the baby. During the first 4 weeks of life, a newborn baby sleeps a great deal of time, usually up to 16 hours each day in 3 to 4 hour increments. Sleep is important for your baby's health. Babies can get overstimulated, cranky, overtired if they don't get enough sleep. Don't be surprised if your baby can only stay awake for an hour or two before nodding off again. Over time, they will get into a sleep pattern. Babies like routines. They like to know what to expect. That's why around 4 to 6 months, it's a good idea for you to establish a bedtime routine for your baby. Tips to help your baby get ready for bed. Wind down any playtime fun. You want to make the transition from playing to bedtime as smooth as possible. You don't want to get them all wound up and then try to calm them down for bed. You're going to turn off your phone, the TV, any outside noise. You're going to give the babies a warm bath, massage the baby, stroke their back softly, play a little song, a little lullaby, read them a bedtime story. That way they know what's coming next and they can ease into sleepy time. Vaccinations, sometimes referred to as immunizations or most commonly known as shots, are an important part of your baby's overall well-being. It is through vaccinations that your baby will get protection without having to build immunity by actually getting sick. It's always better to prevent a disease than to treat it after it occurs. Listed are the most common routine childhood vaccinations. Discuss all questions and concerns about vaccinations with your child's pediatrician. You'll also want to call your healthcare provider with any concerns that you may have with your newborn, such as no stools or bowel movements, and only wet diapers, fewer than 4 wet diapers in a 24-hour period, if their skin has a yellowish tinge to it with diarrhea, if they don't have an appetite, any fever over 100.3, vomiting, difficulty breathing, or if you just feel like they just don't feel right or they're just not acting right, don't hesitate to call your healthcare provider and let them know what's going on. This workshop has been funded by the Children's Services Council of Palm Beach County. Thank you again for listening.